Okay, it's me again, and this time we are on Fundamentals, Chapter 4, the legal and ethical aspects of nursing. So let's get started. So, what is a law? A law is a written rule that governs behavior, conduct, and it's enforced by authorities. What are ethics? Ethics are philosophical studies that examine our actions, our values, our moral principles, what's right, what's wrong, those kinds of things. And ethics and ethical standards change over time. Sometimes they evolve. And as a nurse, it's your responsibility to know your legal responsibilities and the ethical standards in caring for clients. Okay, very important. So common sources of law, constitutional law, statutory law, administrative law, criminal law, civil law, different types of laws. You don't really have to know all of this for our intents and purposes, but I do want you to know some of this. For example, you know, concerns related to legalities, the Nurse Practice Act, those are rules that govern our behavior as nurses from state to state. And that's by the State Board of Nursing, right? That's how we get licensed. Clients' rights, nurses' responsibilities regarding informed consent, individual rights, and privacy. HIPAA, HIPAA, HIPAA. Documentation, which is super important. Ethical issues, the law, societal needs, and healthcare practices are big. And we'll talk about bioethics committees and what they mean and when they're utilized. So some legal terms. What's a crime? A crime is a wrong that's committed against a person or a property or public. Um, it can be the actual commission of the crime, or it can be the intention to do wrong. Okay. And then when it comes to crimes, there are gradations. So you have felonies, which are serious crimes, and you have misdemeanors, which are still crimes, but not quite as big a deal. Okay. Liability. Liability is your responsibility for either your action or your failure to do an action, right? So in other words, doing something or maybe not doing something. And negligence. Negligence is when someone is harmed, usually a patient client, as a result of not performing your duties, procedures, as any other prudent nurse with your level of experience and education would do. Okay. What is tort? Tort is a term that encompasses anytime someone is injured because of another person's either intentional or even unintentional actions or omission of an action. Okay. And examples of tort are malpractice. You've heard that term before. It means treatment that's wrong, that results in injury or illness to someone because of your actions that were incorrect or your lack of actions. And remember this, assault is a threat to do bodily harm. Could be physical, verbal intimidation, like posturing, right? Or threatening somebody. Battery is actual physical contact with another person without their consent. So assault would be telling a patient, if you don't eat, you're going to get a feeding tube put in you. Battery would be putting a feeding tube in without consent. Okay. What is consent? Consent is an individual or a guardian, if the individual is a minor or if they're disabled or mentally incompetent, saying, yes, I agree with what you want to do. And you can go ahead and do it. When do we need consent? Okay. So whenever there is an emergency, okay, an emergency, in other words, a life or death situation. So a person comes into the emergency room and they could die if I don't perform a procedure. Well, there's something called inferred or implied consent. What that means is that I don't need consent because it's a life or death situation. I don't have time to get consent. And because it's an emergency, I can just go ahead and do whatever it is I need to do to save that person's life. Okay. That's emergency. Urgent is different. And I'm actually going to add that in here. So urgent means, yeah, they need this procedure or they need this to be done, but it could wait a day or two. right? So an example of that would be that someone at a nursing home, the resident falls and breaks her hip, and we need consent to do surgery. And the resident is cognitively impaired. She's got dementia. So she's not competent to give consent. We then would have to get consent from a family member or a guardian or next of kin. So remember, emergency situations, life or death, got to do something now. We have implied consent. We don't need signed consent from anyone. We're going to save your life. Urgent means that the need has to be within 24 to 72 hours, and we do need consent. Oops. We need consent. Okay? Oops. All right. Informed consent. Informed consent means that the patient needs to be informed or educated about whatever test, treatment, medication that we're doing, and then also has to understand the potential outcomes, good or bad, complications that are possible, and any alternatives to treatment. That has to be explained by the physician who's doing said tests or treatments or surgeries, and the client has to sign it. And often the nurse will be asked to witness the signature on informed consent. What are you witnessing? And this is important because this is a board question. You are only witnessing that the client is awake, alert, and oriented ×3, not under duress. In other words, no one is standing there pointing a gun at him and saying, you have to sign. He's doing it of his own volition. The patient's not cognitively impaired, and the patient has not been medicated with anything that would impair his or her thought processes. So that is what you're witnessing when you witness a signature of a client on informed consent. You're not witnessing what the physician said, but you're witnessing the client being awake, alert, and oriented, and everything that I just described. So make sure you understand that, okay? All right, other legal terminology, false imprisonment. So using restraints unnecessarily or solitary confinement, seclusion is what that's called sometimes, unnecessarily. And restraints can be physical, such as a lap buddy, wrist restraints, those types of things, or chemical. A chemical restraint would be administering a medication that has sedating properties to someone who doesn't need it medically, but you're only giving it to them to control their behavior. Can't do that. Then a couple more words you should know. Libel. So there's libel and there's slander. Libel is when you write something that is false and damaging. So in other words, I go on to Google reviews and I write some horrible things about my hairdresser that aren't true. Now, if I went on to Google reviews and I wrote, I wouldn't use that hairdresser, she burned my head with chemicals, that's not false. So that wouldn't be libel. But if I go on and falsify information in order to purposefully damage that person, that's libel. Slander is the same thing, only it's verbal. Making statements that are false that would do damage to someone. And defamation, they call it defamation of character, is an act that harms a person's reputation or good name, right? So it's something that's not true, saying something that's not true. Abandonment of care is tricky. That only applies, and I'm going to include this, only applies in 24-hour care. So in other words, if you are working in a facility, whether it's acute care, long-term care, subacute care, you take a report and you agree to take on your assignment, and then you change your mind, then you leave, that's abandonment, okay? So that's what that is. And it's a very tricky thing. Just know that if you refuse an assignment, don't accept report on it and leave, that's not abandonment, okay? Invasion of privacy and confidentiality. And we're going to talk about HIPAA. So it's expected that patients have a right to privacy, right? Whatever personal belongings they have should be left alone. There's no illegal search and seizure. We would need written consent to give out any information about the patient. Okay. All their information needs to be kept private. It's nobody's business. Okay. Following statement, true or false? It's acceptable to give an injection to clients if they refuse and without their written consent. That's false. Okay. That is battery. Okay. And they have to understand what they're being given and they have to agree to take it. Okay. HIPAA, and I know you hear that. It's the Health Insurance Portability and Accountability Act. And that's all about protecting the client's information. PHI, protected health information. Okay. So it's just making sure that their information stays private. Okay. The only time you should have access to anyone's medical records and personal information is on a need to know basis. See how I have that highlighted? In other words, if you are providing care for that patient, then yes, you would have access to that patient's chart. But if you find out that a movie star is in your hospital and you go into the EMR and you look up that movie star's medical records, that's a HIPAA violation. And that, my friends, is a big deal, a very big deal. You can be fired immediately, and there are huge penalties for HIPAA violations. Okay, so just know that. When a client comes into a facility, them or the caregiver would have to sign a HIPAA statement saying, listen, this is my personal information. You can only give it to, and they can name who they agree to have their information released to. It's very important that we maintain confidentiality. If you work with electronic medical records, never share your password. If you work with electronic medical records and you're on a computer or laptop at work, going through or documenting, and someone comes up behind you, you know that you can't let that happen. Log out before you walk away from your computer, always, because someone could come up behind you and see all that information. And there are things like, social security numbers, dates of birth. That's important information that somebody could use with malintent. Okay. And in order to release information, there has to be a signed release form, right? Never, ever, ever discuss anything about a client in public areas, ever. Make sure you protect your computer screen and log off, and just make sure that you're protecting the client's confidentiality. You wouldn't want your business out on the street, right? Okay. We're going to skip over that. Okay. And here's another question. Is the following statement true or false? It is vitally important for the nurse to ask permission from the client each time someone asks about information for the client's condition. No, the client should already have completed a release of information. So, and most hospitals now give out a PIN number to anyone who is able to receive patient information. So this way, when they call the hospital operator would ask for their PIN number, they would provide it, and then they would be connected to the floor or the nurse's station to get information. Only then. Nurse Practice Act. So those are the laws, the regulations that define what we do and regulate our practice. And every state has one. Every state board of nursing has one. Okay. Every state board of nursing has legislative power, and they can initiate regulations and laws that enforce the Nurse Practice Act. It used to be that individual boards of nursing were actually the ones that wrote the NCLEX, which is the National Council State Board of Nursing test that you take to get licensure. But now the NCSBN, they're the ones that write it. And it's the same test, same questions, not the same test, because it's a computer adaptive test uniformly throughout the country. Licensing laws can vary a little bit between states. I will tell you this, for example, nurse practitioners. In some states, they need a collaborative agreement. In other words, they can't work independently. They need a physician to work with. But in other states, they can work independently. So they vary from state to state. This PowerPoint said a national nursing license has been proposed. I will tell you that we now have the Nurse Compact license. So multi-state license is what we have. And so it's available in your primary residence, right? So in other words, in your primary state of residence. In other words, if you live in New Jersey, you can apply for a multi-state license. And I'm going to show you here which states participate in this, okay? And right now there are 43 states that are part of the Nurse Licensure Compact Act. The only ones that aren't currently participating, California is not participating, Indiana, or no, Montana is not participating, Hawaii, Alaska, no. Some states are in the middle of like implementation legislation. So for example, Pennsylvania, New York is pending their legislation. Rhode Island and Connecticut, it's been enacted, but it's not implemented yet. So right now, in that navy blue area, those 43 states, you get a license, a multi-state license in Jersey, you can practice in any of those 43 states. Okay. Okay, let me make this smaller. So, the Nurse Practice Act, like I said, it defines practical nursing, registered nursing, and advanced practice nursing. Okay. It describes what we basically can and can't do. Okay. So it tells us what we are allowed to do, what our functions are, tells us what the process is for getting a license, how we maintain our license, what continuing education we need. It also issues the license and renews the license for us. And it also has the power to suspend, revoke, and reinstate the license. So that's important to know. And there are certain rules that have to be followed, or you might not have a license. And this interstate endorsement, I'm just getting rid of that because that's not accurate. Okay. Important points to remember. So you may hear someone say, oh, an LPN can't do that. LPN can't do an IV. LPN can't do a wound vac. According to the Board of Nursing, that is not true. Your scope of practice is defined by the Nurse Practice Act, but a facility might have a specific policy or protocol that says LPNs can't do this, that, or the other. So, when you hear someone say, oh, you're not allowed to do that, it's usually not the Board of Nursing saying that. It's usually some kind of a policy within the facility that you're in, right? Just use common sense. If you're not sure about something, it says ask questions. I would say look for policy and procedure manual called P&P. Look at your policy and procedure manual. Anytime there's an error, it has to be reported immediately. And anytime there's any defective equipment, you report that to your superior too. You do not want anybody to get hurt, including you. Okay. So I hear nurses say, my license, my license. Why would your license get revoked or suspended? Okay, so some of these things here are potential reasons. Drug or alcohol abuse, although there is a impaired nurses program that most states have that will help you get help, okay? Any kind of fraud that is Medicare or Medicaid fraud, right, would immediately preclude you. Deceptive practices, certain criminal acts, previous disciplinary actions, if it's warranted. So, and any gross negligence, I'm not going to say ordinary negligence, gross negligence. In other words, you not doing the right thing by your patient. But understand this. The board doesn't sit there up in Trenton and go, boy, we can't wait to take that nurse's license from her. They don't do that. So, understand what are punishable offenses. And, it's not as simple as it sounds. I mean, it's a complex thing. So anytime there are, felony charges, any charges that have to do with Medicare or Medicaid fraud, or anything where it's a crime against a vulnerable individual, like a senior citizen or a child, child pornography, those kinds of things. Those are offenses that would prohibit you from getting licensed. Okay. So how do you get a license? Well, you've got to pass your boards. When I say your boards, I'm talking about the NCLEX. So, the NCSBN, they're the ones that administer it. It's in every state. The questions are actually written by nurse educators. It's a computer adaptive test, which is important. And that means that the first question that you answer dictates what the next question is, and so on and so forth. So, it's different for every single person. So don't ask anybody that's already taken it, hey, how was the NCLEX? Because for them, they may say, oh my God, it was so hard. Somebody else may say, oh, it was a breeze, it was so easy. As long as you know what you need to know, you're going to pass, okay? And know this, if you move to a different state, you don't have to retake the exam. You can just get a license in that state via reciprocity or get a multi-state license. Okay, so that's that. Legal responsibilities, okay? You want to make sure that you understand that you could be held liable for any harm that a client suffers because of something you did. And not only you, but whoever you're working for, right? And they can become malpractice lawsuits at any particular time, and you don't want that. So here's some common sense advice, okay? When in doubt, look it up. I wouldn't even say ask someone because you might not get the right answer. Look it up. Look it up in a credible source. Don't just Google it. Google is just a library. It is not the be all end all to answers. Okay. Look it up in a credible source. Go to the Merck manual, the National Institute of Health, the Davis drug book, but look it up. Be competent. Question everything. Document objectively. No opinions. Never give legal advice to clients or anybody else for that matter. And you cannot accept gifts from your clients. Okay. So if they try to hand you cash or something like that, that's inappropriate. Okay. There are some states that will require nurses with our education to work in the event of an emergency. I'll give you an example. I have a Florida license, and if there's a hurricane and they need help, nurses that are licensed and living in Florida, we have to go help. Okay. And that's just the right thing to do, right? Just the right thing to do. One more thing you should know is something called the Good Samaritan Act. And what that does is it protects you against liability. If what you did made sense within the limits of first aid and you were acting reasonably and prudently, in other words, you're walking down the street and someone's on the ground. They don't have a pulse, they're not breathing, you do CPR. You break some ribs doing it. But the patient's alive. They can't sue you for breaking their ribs. Okay, so that protects you. Good Samaritan Act. Professional boundaries. This is something that sometimes is problematic. Let me try to explain. You must always maintain a professional relationship between yourself and your clients, your patients, and their families. Okay. Don't tell them your personal business. Don't discuss your family. Don't discuss your children, your grandchildren, your divorce, your money problems. Any of those things are off limits. Okay. If the patient were to ask you, hey, do you have kids? What I say is, yeah, 3 of them. Tell me about you. Do you have children? So I take it from me and I deflect it back to them. So let them talk. You don't want to be accused of crossing a professional boundary. Okay. That can be very damaging to your reputation. Okay. And obviously professional sexual misconduct. Don't do that. No TikTok videos, no twerking. Okay. Who's a vulnerable individual? Children, minors, adults, and it's usually older adults, people with cognitive impairments, right? Hospitalized people, people with mental illness, intellectual disabilities, people living isolated lives, okay? The law specifically protects vulnerable persons from harm. If you had a charge against you and were found guilty of doing something to a vulnerable person, you probably would not be able to get a license. Okay. They talk about what is the definition of death. So what the definition of death is that the person has stopped breathing and their heart has stopped beating. Okay. So when we talk about the definitions of death, we're going to look at the legal death and brain death. Okay. Legal death is someone who the heart stopped beating, respiratory function has stopped. In other words, they stopped breathing, the heart stopped beating. Brain death, irreversible cessation of all neurological function of the entire brain, including the brain stem. So that means that someone who's been in a terrible accident, the brain has been damaged to such a degree that they are basically a vegetable. Okay. Um, and I have to look this up. I'm actually going to pause for a second. I added a little stuff here to add clarity. So with brain death, the actual legal definition of brain death varies from state to state, believe it or not. But to try to make it, kind of uniform as much as I can, I included here the most common processes that lead to brain death: cardiopulmonary arrest, traumatic brain injury, a subarachnoid hemorrhage, and an intracerebral hemorrhage. And it does indeed include the loss of voluntary and involuntary neurological function. So the patient would be on a ventilator, right? And once brain death has been diagnosed, the patient is legally deceased, but they will keep them on life support if they're an organ donor, right? So to make sure they have time to harvest the organs. There's a lot of controversy surrounding this. So this would be a conversation in and of itself that we will have in class. Okay. All right. And this gives you some of the criteria, what has to be going on with the patient to determine brain death, right? All cranial nerves are unresponsive to cephalic reflexes. I'm going to put in here no cranial nerve function. Okay, so in other words, when life support is stopped, that's the end. Okay, just so you know, that's the end. Like I said, this is something that would warrant its own conversation, all right, which we can have in class. We're not going to talk about that. Let's talk about ethics and standards of care. Okay, so everyone has different ethnicities, different kinds of cultural behaviors that go along with those ethnicities. And, sometimes we bring our own personal values to work with us, but we can't impose them on our clients. Okay. There is a term that is called ethnocentrism. I'm going to put that here. Ethnocentrism, which means that I think that my ethnicity is better than everybody else's. Okay. That's not good. Okay. So we need to be open-minded and we need to practice cultural awareness so that we try to understand, other people's cultural habits, characteristics, etc. Okay. When we talk about ethical standards for quality of life versus quantity of life, that's complicated, right? Do we pull the plug on that or not? So that's a conversation in and of itself. And, as nurses, what's our role, right? So we're expected to practice in an ethical way, but sometimes we're the first ones that identify ethical dilemmas and we bring them to the attention of someone at our job. Usually it has to do with things like organ transplant, right? Refusing treatment, withholding treatment. I won't call it euthanasia, but I'm going to call it physician assisted suicide, which is legal in New Jersey. I don't know if you knew that. So, if someone has terminal cancer and they decide that they don't want to continue with treatment, that is their right. But sometimes it brings up an ethical dilemma, Again, this requires a very lengthy conversation. All facilities, well, hospitals definitely have what's called a bioethics committee. And it's a lot of different healthcare professionals, chaplains, priests, ministers, social workers, etc. And they kind of get together to share their ideas and try to act as advocates for clients. So if you've got a patient that's on life support and you have, one family member saying, pull the plug, another family member saying, no, no, don't, that becomes an ethical dilemma. So an ethical dilemma is a dilemma where there are two choices and someone has to choose, but the family or the caregivers don't agree. And so that's when we call bioethics in. Okay. When we talk about nursing ethics, the American Nurses Association came up with a code of ethics for nurses. And pretty much every board of nursing in the country has adopted this code of ethics. So, it talks about practicing with compassion and respect for the inherent dignity, worth, and attributes of every person. Your commitment is to the patient and whoever that patient is, an individual, a family, a group, a community, or population. You promote, advocate for, and protect the rights and health and safety of your patient. You have authority, accountability, and responsibility for your nursing practice. You make decisions and take actions that are consistent while understanding what your obligation is to provide the best care. You owe the same duties to yourself as you do to others. In other words, take care of yourself, your health, your safety, right? Preserve your wholeness of character, your integrity, maintain your competence, and continue personal and professional growth. You maintain and establish and improve the ethical environment of those around you, right? So make sure it's a safe work environment. The nurse in all roles and settings advances the profession through research and scholarly inquiry. In other words, you're going to look something up. It's got to be from a credible source, and it's got to be science-backed. It can't be, I heard someone say, or I Googled. No, it's got to be based on empirical evidence. That's called evidence-based practice. The nurse must collaborate with other health professionals and the public to promote human rights, to provide health diplomacy, and reduce health disparities. In other words, make sure that everyone in this country has a shot at getting the health care they deserve. And the profession of nursing collectively, all of us, through its professional organizations, must articulate nursing values, maintain the integrity of our profession, and integrate the principles of social justice into nursing and health policy, right? So stand tall. We are the most trusted profession in the country, year after year, okay? Okay. When it comes to nursing ethical values, I am going to add a slide that's going to go through, which I'm going to do right now. The nursing ethical properties, which are veracity, which means truth, okay? Autonomy, which means the patient is an active participant. The patient adds to their plan of care. And then there's justice, I remember, and justice for all, which means everyone gets treated equally. Everyone's treated the same, okay? And we have maleficence. I'm going to hope I spell this right. Maleficence. We have beneficence and non-maleficence. Beneficence. And then we have non-maleficence. NCE. There we go. Beneficence is doing a good thing, right? Actively doing a good thing, right? So doing good, like doing CPR on someone if you find them lying on the ground. Non-maleficence means do no harm. So that could be a non-action, like if your patient says, I want a bath in ice cubes 5 times a day. You wouldn't do that because you know that that is not good for them, right? So you wouldn't do that. And then we have fidelity. People get divorced because of infidelity. So fidelity means trustworthiness, right? Trustworthiness. If you say you're going to be back in 15 minutes, be back in 15 minutes. These are important things to build rapport with your patient and to build trust, right? We go. Okay. And then what are the client's rights and responsibilities? Well, they have them too, right? There's always a Bill of Rights in any facility, any healthcare facility, that explains what the patient has the right to, right? They have the right to autonomy. They have the right to be a participant in their plan of care. You know, they have the right to dignity and self-worth. The responsibilities are also things like understanding that it's a partnership, you know, making sure they're being honest with us as healthcare providers so that we can give them the right care. So, you know, taking into consideration their health history and information. They need to understand that their lifestyle choices have an impact on their health, right? And you want to make sure that the healthcare institution has a copy of the advanced directives, right? What are advanced directives? Let's get to advanced directives. Oh, we did talk about them. Is the following statement true or false? Various laws and ethical standards which are in place are designed to ensure each client receives the best health care possible. I mean, that's Pretty easy. It's true, right? That's why we have these rules in place to make sure that everyone gets equal quality health care, all of us together. Okay. All righty. Well, I think that that is all we've got for today for this chapter. I am going to talk to you guys at the next PowerPoint. All right. Have a great night.